Hello, I'm Marshaun Butler, Chair of Health Forward Foundation's Board of Directors. Thank you for being with us today. Before the pandemic, we were planning a spring luncheon to celebrate our important work and significant impact over the past 15 years. But then when the COVID-19 pandemic reached the Kansas City region, we immediately shifted our focus to the critical priority of responding to the crisis. The pandemic has challenged all of us in ways we could never imagine. While it feels like there isn't much to celebrate during these difficult times, we feel it is important to take a moment to pause, reflect, and celebrate all that we have done during and before the pandemic to keep our communities safe and healthy. We are here today to thank you, our partners, for your commitment to those most in need and willingness to work towards shared goals. As we engage today, please share your thoughts and questions in the comments section wherever you are viewing this. Toward the end of our time together, we will take a few minutes to catch up and answer those questions. 15 years ago, Health Forward awarded its first grant. The grant was a $25,000 contribution to support the Health Levy Ballot Initiative in Kansas City, Missouri. That small investment by the inaugural board of directors has leveraged close to $50 million annually for healthcare in Kansas City. Since that first grant, we have partnered with more than 500 organizations and infused the region with over $300 million in investments that improve health for all. By now, you should have received a commemorative Health Forward coloring book in the mail ahead of today's celebration. If not, no worries. We have plenty of extra copies sitting in the office. The coloring book is a visual representation of the people and communities that have joined us on our journey toward better health. The pages are full of thematic illustrations that we hope you will fill with vibrant colors, creative thinking, and outside-of-the-box ideas. In many ways, it is representative of the very partnerships we formed over the past 15 years. Please continue to color and share these images on your social media channels with the hashtag HealthForward15. That's HealthForward15. Partnering to develop equitable solutions has always been core to our mission. Philanthropy alone cannot eliminate barriers to health. It takes you, me, it takes everyone. Initiatives like Metro Care engage providers to connect uninsured patients to specialty medical treatment. This investment leveraged more than $8 million in a donated service. A 10-year investment to help safety net clinics expand their operating hours resulted in 73,000 additional medical visits patients would not have been able to make during regular business hours. The Healthy Communities Leadership Academy has developed 100 community leaders into empowered change agents who are advocating for policy and environmental change to improve health choices for all, especially those most in need. We amplify community voices by supporting health-related news coverage. Despite the changing media landscape and decline of traditional print resources, we collaborated with our nonprofit media partners. Last year alone, our partners shared more than 1,000 stories about health disparities that in the past were whispered instead of broadcast. We've pushed the boundaries and challenged the status quo by advocating for policy change. We've ensured our communities have clean indoor air and increased the age to purchase tobacco to 21. And just last month, we joined with our Healthcare for Missouri partners to celebrate the passage of Amendment 2, a collective win which expanded Medicaid to more than 230,000 Missourians. All of this would not have been possible without a dedicated board of directors, community advisory committee, and group of associates led by Steve Rowling, Dr. Bridget McCandless, and our new president and CEO, Kiana Thomason. When looking for our next CEO last year, We knew we needed a person to lead Health Forward through a very deliberate process of exploring what health equity means to us and how we purposefully address race equity to move health forward. Kiana Thomason was our choice then, and her arrival and leadership has reaffirmed our belief that she is made for this moment. A lifelong Kansas Citian and proud native of the 3rd District, Kiana brings a deep firsthand understanding of the complex socioeconomic challenges that come with being uninsured. She's also championed health equity for over 20 years across health policy, healthcare delivery, and healthcare payment sectors. At our founding, our inaugural chair and vice chair, Dr. Harry Jonas and Gurney Gunter, along with the inaugural board and staff, ensured that diversity, equity, and inclusion were the guiding principles upon which Health Forward was formed. As we mark this milestone and anniversary and rededicate ourselves to these guiding principles, we are embarking on a new journey in a new era and time that requires us to more deeply explore and address the social factors that impede health. Even before the murders of George Floyd, Breonna Taylor, and Ahmaud Arbery, Health Forward knew we needed to address inequity as a primary influencer of health. As we sit remotely here today, it's clear that we've reached a pivotal moment in our country's history. Recent police shootings and murders of Black Americans, coupled with the racial disparities and COVID-19 infections and deaths, are laying bare and underlying impacts of structural racism. The moment is calling for change, a new vision, and while we are here today to celebrate, we also want to use this platform to share with you how we plan to move forward in the years to come. Before we welcome Kiana and hear how Health Forward plans to achieve our ultimate vision of healthy people and healthy communities, we want to share a video to thank you, our valued partners, for the many ways you've contributed to a better picture of health for our community.